As you probably know, Altman has made the commitment to high reliability, and we're glad that you're continuing with us on our journey towards becoming a highly reliable organization. Even though we practice evidence-based medicine, opportunities for error or harm reaching our patients will always exist. We have learned from other highly reliable organizations like nuclear power plants in the Navy that the path towards high reliability is an ongoing journey. It's one that really never ends. Thank you for your participation in past HRO training. If you remember, we focused on communicating clearly and speaking up for safety. In an effort to continue using our tools and tones effectively, our next area to focus on will be cross-monitoring.
High reliability organizations work to create an environment in which potential problems are anticipated, detected early, and responded to early enough to prevent errors. In addition, these organizations also do things as intended consistently over time, accomplish goals, avoid potentially catastrophic errors, identify and resolve system flaws that contribute to errors. Adopt human error prevention strategies to reduce the risk of preventable errors. We are committed to using our tools and tones to identify and prevent system errors. By using these error prevention strategies, research shows that we can reduce patient harm by up to 80%. The Swiss cheese model demonstrates how there are checks and barriers built in within a system to help catch and prevent errors. Error prevention strategies help us to find and fix the holes in our system. Events of harm are often not due to one particular mistake, but happen because there were several mistakes. This model also demonstrates how, if only one person in the chain of Swiss cheese had done something different, the event could have been avoided altogether. We need to all feel comfortable reporting errors and events when they occur without fear of repercussion or reprisal. When the holes are discovered through good reporting or root cause analysis, they need to be fixed by leaders, or if resources are not available, other barriers need to be put into place. Using our tools and tones helps us plug the holes of the Swiss cheese.
Many physicians across the healthcare delivery system are committed to Altman's journey towards high reliability. Some of our hospitals require training as part of our re-credentialing process. As our system grows, we anticipate the addition of new medical staff and are excited to welcome physician team members to be part of our high reliability journey. So let's review the tools and the tones. Our tools for high reliability are pay attention to detail, communicate clearly. The last time we discussed asking a clarifying question. We ask each other clarifying questions if something is unclear. You may also recognize other components of the communicating clearly. They are read back and repeat back of verbal orders, numeric and phonetic clarifications. SBAR is a standard format for passing along pertinent information. S, explain the situation. B, provide background information. A, this is your assessment. Or R, give your recommendation. Think critically. Cross-monitor. We can't help each other if we don't stick together. Cross-monitoring is an easy way to help our coworkers and ourselves to perform our best. This is our new focus, and Dr. Cerrone will talk about this. And speak up for safety using ARC. We also have tones for teamwork. They include smile and say hello, introduce yourself, listen with empathy and understand, provide opportunity for questions, communicate positive intent. Sometimes explaining what you're doing can help prevent confusion.
Every employee is responsible for the safety of our patients and each other. We spend a lot of time together, we observe each other's behaviors, and we value the opinions of our peers. We can have a lot of influence in either promoting good behaviors or discouraging bad behaviors. Cross-monitoring is the tool that will help us accomplish this, and it applies to more than just safety.
Cross-monitoring involves peer checking, peer coaching, and 5-to-1 feedback. Think of this as having a wingman, someone who is looking out for you, and you are looking out for someone else. When we have each other's backs, we can prevent errors from occurring. Peer checking is initiated by you. You approach someone else to check your work.
Peer coaching is approaching someone else based on a behavior that you observe. When you observe and acknowledge that someone is practicing a safe or positive behavior, this is called coaching to support. A smile, a head nod, or a thank you are simple ways you can do this. When you observe and do something about an unsafe or non-positive behavior, this is called coaching to correct. Correcting unfavorable behaviors can be challenging because it requires approaching a coworker about something that they are not doing right. But we don't want to miss the opportunity to address an unfavorable behavior. Letting it go can send the message that the behavior is okay, and what you permit, you promote. Whether it's coaching to support or coaching to correct, peer coaching does not have to be a big event. Use the lightest touch possible, which means keep it simple. And remember, be open when others peer coach you. It is not a personal judgment, it is about changing behaviors to prevent mistakes.
5-to-1 feedback provides an opportunity to recognize positive behaviors. It identifies those doing a good job and supports teamwork. Occasionally, we may need to correct some behaviors. If this is necessary, base your feedback on what you observe, not what you've heard from others. State the expectation, then explain how your coworker's action is either meeting or not meeting the expectation. An example could be approaching a coworker who did not wear personal protective equipment when entering an isolation room.
As medical staff members, let's join together to create an environment of high reliability and positive teamwork.
We can do this by continuing to communicate clearly and speak up for safety using ARC.
Now let's add cross-monitoring as a way of building a greater sense of accountability.
This is all about helping others to do the right thing and expecting that they will help us to do the right thing too.
Thank you for joining us on this journey of becoming a highly reliable organization. If you have any questions or concerns, please don't hesitate to call the medical staff office.